I'll send something email out. So you want to get this automatic. And we type it in and go. Okay.
Oh, yeah, you will. Fix it. Do that.
I don't know. I'll work on it. I didn't say it.
We're practicing problems.
I hope I do. I need to. What we got to do is we have to switch. Oh, no. I was already counting days down. Next Monday, get foot hours, should get cut loose Tuesday, go to range for 12 minutes, then go back in uniform, and that happens. I did. I'm actually feeling much better today than I did yesterday. I've had it happen all week.
That's what I did. I was in Ohio miserable.
Yeah, I was, well, and for me, I didn't, number one, I didn't think everybody there sick. And, the other was, I'm trying to get recovered for Thursday, to get surgery. Because Leslie, that's the lady, so. So we get that taken care of. It's already been over 3 weeks. Yes, yes. Get moving along. We'll just see what we're seeing. Yes, sir. Well, I do have it, sir. And I'm going for surgery Thursday morning. Completely severed 2 of the 4 tendons, the rotator, and tore the leg. Yeah, they said I did.
I think we need to make you one of those signs that explains it all.
Yeah, it's
Right there.
Tell the whole story.
How'd you do it? Didn't even know.
That's right. Oh yeah. Oh definitely. Yeah. Elderly Bill. Are you sure? We were in a restaurant.
That's what you're talking about.
Only people that I'm getting there. But he had fallen coming into the restaurant. 81-year-old. So if they want me to go where I said, well, when you're ready, I'll carry it out for you. So I've got a piece of box and 2 bags on the right arm, and we're walking across the parking lot. And he's walking with a cane. He's, we're walking. I get home, I do find one of those shoes on. I think it's in the house. I think it's the shoes that are making me unsteady on my feet. He took about 2 more steps, and I see him start to go down. I reached out with my left arm to grab him, and it sounded like a shirt tearing. So, yeah. And I couldn't move my arm. Went for an x-ray that night, and they're like, bone-wise, they're fine. I was broken, but I guess you tore your rotator. And then finally got in for an MRI. And at that point, I couldn't do it at all. It was pain-wise. By the time I went back a week and a half later for the follow-up, I could do this, and I could do this, and this, but this motion, it was like there's nothing to catch. I didn't want to make it go this way.
It'll be my son's were his leg. I will tell you the shoulders were better than him.
Yeah.
That oldest tore shoulder, soccer. Middle one, when they played soccer. The middle one tore leg and his hip twice in 11 months. 2 surgeries. So that poor kid's 26. He might make it to 40.
Oh, gosh. Both my sons were in Vegas, so and one of them had 3 concussions playing.
The middle one was serious. I mean, it was
Oh, yeah.
serious thing ever.
Call to order the New Kent County Board of Supervisors, February 27th, 2024 work session to order. Ms. Watkins, will you call the roll?
Mr. Evelyn?
Here.
Mr. Moyer?
Here.
Ms. Pearson?
Here.
Mr. Steers?
Here.
And Ms. Stewart?
Here.
Good morning and welcome to everybody watching for this short agenda this morning. So let's get to it. First item this morning is Rappahannock Community College presentation by the President, Dr. Kennedy. Welcome.
Thank you so much. It's always good to be here with you all, and I'm so glad to meet your new supervisors that I hadn't had a chance to meet yet. So, let's make sure I can get this. All right, I got to be on a 3rd monitor.
If you can move the cursor to the screen.
This one?
Yeah.
clicking. Where did it go? It's just a little slow. Okay. So, yeah, bear with us. I gave them quite the challenge this morning. So I just wanted to talk a little bit about college. We do have some new folks, so I will forgive me, Chair Evelyn and Supervisor Steers, for repeating things that you already know, but I want to make sure everybody has some information. So fall 2023, we have our numbers in. And so we look at, when we break it down by county, we do serve 12 county region, which goes from King George, you are the farthest west, to Gloucester, and then all the Middle Peninsula and the Northern Neck. So it's approximately just about 3,000 square miles. So we do have quite a challenge. We have 2 campuses, one in Warsaw, one at Glens, and we have sites in Kilmarnock, New Kent, King George, and Montrose. As well as we work with every high school, the 14 public high school divisions in our service area, offering dual enrollment. And that's one reason why New Kent is showing the way it is. When I started, New Kent was more on the bottom of the 12 counties with student participation. We did a very targeted marketing campaign in New Kent this past fall. I hope you saw some of the ads that were very specific to New Kent County. But Gloucester, of course, and Gloucester is still our largest county. You're all working on it as the fastest growing county in the Commonwealth. But we had 476 students from Gloucester, and then New Kent was second. And you were fourth 2 years ago, third a year ago, and second now. So, and I know a large part of that is dual enrollment. We've worked very closely with the high school to increase our dual enrollment offerings. King William, so King William had edged you out last year, so you have more New Kent County citizens attending RCC. And this is, let me mention, curriculum only. And it's very confusing because the way that we like to talk about students, I say a student is a student is a student. They come to us and say, I want to be in welding. They don't care that that's not a credit program. They're getting their credential, which is what they need for a job. That's not included in these numbers. And so we're still working to figure out the best way to calculate that. And that is not just us, that is our entire Virginia Community College system. By the way, there are 23 community colleges in the Commonwealth. So this is actually a greater number and will increase, and I'll get to that in a little bit. Richmond County, of course, and of course our Glens campus is in the very upper end of Gloucester County. And Richmond County, the campus, Warsaw campus is in Richmond County, so that's not quite as surprising. It's a very interesting thing that has happened since the pandemic. By the way, I've been here since July 2019, so welcome for 7 months. Let's shut down. So I kind of think there's been like 2 years of an abyss over here where, you know, we didn't get to do some of the things that we had hoped we would be able to do. But we also got some opportunities we wouldn't have had, and I'll get to that in a little bit. But again, you'll see some of the reason why Gloucester, New Kent, and King George are up there, the largest high schools of the 12 county service region. So a lot of dual enrollment. All right, I don't know where the heck I am. I don't see a cursor. There it is. Okay. So really excited that we were able to start a diagnostic medical sonography program with an echocardiography certification. That's a mouthful. Has anybody had an echocardiogram? That's what we're training to do. So VCU Health came to us and said, and one of the reasons, one of their leading cardiologists is for all the smaller hospitals, so VCU Tappahannock, they put one of their leading folks from, you know, wherever, cardiac center, joint, whatever, on these smaller boards. And Greg Hunley, Dr. Hunley, is the cardiologist, and he really wanted to increase the availability of cardiac care at VCU Tappahannock. I think part of it is because he has a retirement home in the Northern Neck, but we'll take it. So we were able to, with VCU Health, get $950,000 over 2 years from the General Assembly to start this program. We are not funded for startup. We are not funded for a whole lot of equipment. It's a very weird funding model we have at the VCCS, which, by the way, we're working on, and I am the lead president leading that goal because it's not what we need. But we strategically placed the first lab here at our New Kent site. And those are pictures of it from this morning. So we transformed one of our classrooms. And so you see our students are going to go in 2 years. They're going to be certified to do echocardiograms, which has a starting salary of about $70,000 a year. So it's an incredible program, very, very expensive, obviously, to run because we're limited numbers. We have 8 students. We just started it in the fall. And we will have 2 labs. We will eventually have one at Warsaw. But we started in New Kent strategically because there are only 4 community colleges that have sonography at all, and only 2 of us that have echo, and that's Nova and Rappahannock. And so Bright Point, Reynolds, none of those have this program. So we thought, let's be in New Kent where we can draw from a larger area. We're going to attempt, and I don't think we're going to get to. Can you click the link for me? Because it would be a whole lot easier. All right, we don't think we're going to have sound, but I'm going to tell you what this is, and I'll send it to you. Okay, so this is I just wanted you to see, this is a story about the sonography program with VCU on Channel 12. So we have gotten some great publicity about it. So this is, and you'll see some pictures of our students, and of course, Dr. Hunley. So this, I'll just let you watch for a second, and even though you don't have sound, you get the idea. That's Dr. Hunley. Good try, Wanda. Oh, you can hear a little bit, and there's closed captioning. All right. This is our program head. Real students, by the way. All right, so you got the idea. So I don't think we need to see him. He doesn't live in New Kent County. So we're really excited about this program. It'll grow. We can take 20 students when we're at full strength. Again, this was the first year, which I told students, it's the best time to apply in these first few years before it gets to be a high-demand program like nursing, where we won't be able to accept all applicants. So you also know we are, I would say at the finish line, but I'm just not willing to do it. With our welding lab in the cafeteria in the historic high school, we did get, and this is not final numbers because I'm not going to calculate everything until we've got all the equipment in, but we still haven't done all of our change orders and our final billing. But we did get some funds, thank you. New Kent County actually applied for the grant, and I just want to give a shout out to Becca Carruthers for her awesome help. She's been amazing. But we did get $300,000 from Go Virginia, which funded some equipment, rent, which is $42,000 a year. Utilities, we split those costs, and design services, so architect fees, which, by the way, are out of sight these days. You know, you're all doing these things. So we budgeted for 75 on design. It was 81. Our original contract for construction was over $739,000. We had to rebid that. That delayed the project because the original bid was like $1.5 million, and we had to cut back. We were going to finish out the entire 4,000 square feet, but we knew we couldn't do that, so we cut it back a little bit. But we are renting the entire 4,000 square feet. Our equipment's over $200,000, and so we were able to match that Go Virginia money with some of our HERF funds, which is higher education economic relief funds. It's COVID money is essentially what that was. And we were able to do that. So as I said, when we came and pitched the project, this was a once-in-a-lifetime opportunity because of COVID. So I said COVID impaired some things, but gave us some other opportunities that we wouldn't have had. So we are at least $750,000 that we've had to fund out of our state budget. And as I mentioned, we do not get funds. We do not get funds for startup of programs. We do not get funds for renting space. Those are all things we have to manage within our budget. All right, next. See, the cursor just disappears. Thank you. So these are pictures from this morning. We are waiting on the electrician. Literally, I went, and I have the contractor, one guy from sitting in the dark in the welding lab, waiting on the electricians who did not show up when they were supposed to. We were hoping to have final inspection this week, but until the electrician gets their work. So on the left, this used to be the kitchen. In the cafeteria, this will be for materials, fabrication, cutting of the welding, the metals. And the right is the lab, which you can't see a really good picture because there is no electricity. Those are construction lights. So that's what we're waiting on, is the electrician to be able to run all those to the booths. There are 10 booths, with one being a handicap accessible booth. So we have not scheduled classes. We advertise. We have a waiting list of students. And so I said we're not scheduling until final inspection. And then we can call those students and come up with our start date. We have an instructor. One of the reasons we did this project is we have been finally being included in Newport News shipbuilding and their needs. They are so desperate, they have now just gone beyond Hampton Roads, including the Eastern Shore and Rappahannock Community College. And most of our welding instructors are retired from the shipyard. They live in Gloucester. So our folks commute. And this was a great location because of the proximity to 64. This makes this a doable. For other jobs, our priority is always to keep people in the service region. Our total 12 county, 70% out commute. I don't know what it is in New Kent, but I'm sure it is maybe even higher than that. So we're trying to provide the training for jobs that are in the service region. Because I don't know about you, but I don't want to drive to Richmond or to Newport News or anywhere else. Yes?
Are those labs set up to be stick, MIG, and TIG welding, or is it certain?
5 different certifications. And they're all American Welding Society.
Okay, that's good.
And we are looking to get certified as an AWS shop. Gold standard. Okay, if you go to the next one for me. So I just wanted to talk a little bit about our partnership with Bridging Communities. You can't see this, so I'm going to walk you around. And again, they've got the PowerPoint, so if you want to look at it a little more closely. This is the area, our original space that we have been in since 2015, which you all have graciously waived the rent for that time and until July 31st, 2025. The classroom so I'm going to go around clockwise. The classroom to the left, we have a science lab in there, which we have not used. The pandemic did change our demographics. We have a significant portion of our students completely online and less students on campus. Unless they are in a career and technical field, there are very few students on campus. So we have lots of nursing students. We have over 200 nursing students this spring. But that classroom is not used by us. That is used for Bridging Communities Farm Tech program, which we helped start with them through a grant that we received. We got the funding for them to start that program up. It was originally dual enrollment. It is no longer dual enrollment, so those are just bridging students. Right above that is a nursing lab. And I say it's important to know because we do have so many nursing students. We have labs at Warsaw, New Kent, and Glens, and our students travel through all. They are at all sites because their clinicals are everywhere. They do go to Richmond and to Newport News and to everywhere else. To the right of the nursing, that is the diagnostic medical sonography lab. To the far right is a classroom that Bridging uses for culinary 2 times a week. And then the classroom on the far bottom is used by us in the evening for HVAC, and Bridging uses it for HVAC during the day. So we do not charge them any rent. If you could go to the next one. So that's just a little bit, but again, I would have had to put this in so many pieces for you to be able to see it, but you can have the PowerPoint, so if you can want to look at that. So this is a little bit hot off the press. It's something we've been working on, but I have brand new information as of yesterday. This is a warehouse at Glens. I'm not sure if you know, but we were asked to not offer our diesel program in the Bridging community space, so we've made do with this warehouse, but we are renovating it. We will move our welding lab that's at Glens from retrofitted space to this is a 4,000 square foot brick warehouse with 2 roll-up doors and restroom facilities. And I'm just very pleased that our facilities manager there said, you know, if we got a prefab warehouse, this would make great instructional space, and we don't have anywhere to go. So the front half of that will be diesel technology, and the back half will be welding. That will allow us to increase the number of welding we can do there. There is enough demand for welding. We will have it in 3 areas across our service region that we feel good about that. Particularly, we do dual enrollment welding at the Glens campus, and we will be looking at that for here as well. But this will allow us to offer diesel as a full-time program. We do have commitments from Essex and Lancaster to send their high school students for diesel, welding, and HVAC. HVAC, we currently do part-time evening program here. Where we currently have welding, that will become HVAC for where we can offer a full-time program and dual enrollment. And then the hot off the press is maritime electrical and engineering. As I mentioned, Newport News Shipbuilding, they're ready to build submarines. They need this workforce that's amazing. And we just found out yesterday, for sure, we've been told we were going to get some money, that we got through the Navy, we got a $2.5 million grant to help us with the welding and start. So we were working, we cobbled together a couple of grants, but this has been able to make us be able to finish this project. So these are things that will be coming in the next 2 years. Okay? And then we are raising funds to build a new health sciences building. This will be located in Warsaw, but as I mentioned, our students go through all of our sites. The reason this is in Warsaw, one, because this is where we'll put that other sonography lab. And we did get some funds with the help of VCU, and VCU Tappahannock is in Tappahannock. So this will have nursing simulation rooms, which we do not currently have, an EMS simulation area where the ambulance can drive up, like it'll be like a small little living room where those students can practice going in like they would to a house to take care of someone, to load them on the ambulance. And one of the reasons also we're doing this is this will be located, if you've been to Warsaw, the Chin House, which is our 1908 historic house, to the right. Our foundation owns those 2 lots. They are not state property. And so we can make this happen a whole lot quicker. We are applying for an Economic Development Administration grant, hopefully by the end of next week, thanks to, it's called a Disaster Supplemental Relief Fund. In February of 2021, we had an ice storm that impacted about 7 of the counties that we serve. I don't remember it, but it was a good ice storm, apparently. And that qualified us for these funds, which means we can get up to 80% of the cost of the project. It's a $6.2 million project, so we're looking at over $4.8 million. If we get that, we're moving. We're going on to construction documents because we have some matching. We've been lining things up with some other foundations. So those are a couple of things that we've got going on across the service region. I'm happy to answer any questions that you all might have. Oh, I should say the budget request. I cannot thank you enough, and I understand why you've not funded us for the last 2 years. But I have to ask, because we do ask all 12 of our counties to support us. Thank you for waiving the cost of the rent, which is $67,000 per year. We are now paying $42,000 for the welding space and splitting the utilities for both areas. We also pay for cleaning, which Bridging uses the bathrooms that we pay for the cleaning as well as some of your folks, which is fine, but we do have some other expenses. Our request is just $53.56, and I was telling Mr. Hathaway that is the lowest request, but I think we went back historically to how many students were served. And if you go back way before my time, there weren't as many from New Kent. Now you see we're in a different situation. But Gloucester, of course, is the highest request, and you all are the lowest request, and I just appreciate any consideration, but I certainly understand your position.
Thank you, Dr. Kennedy. Very informative. Any board members have any questions?
Covered it well enough, I guess.
Yeah.
Thank you all so much for giving me the time, and especially Fred. I want to thank you all. Debbie Richards is a great board member, and she would have loved to have been here, but you know that work thing that gets in the way. So she sends her regards. So thank you all.
So schools will be done?
Excuse me. Oh, They told me yesterday, we've got bad news. I said, I'm not surprised. I'm just not surprised. You know now this is how it is. They just don't show up.
Yep.
But I'm hoping that we will be up and running by the end of March, and we will be doing, I want to wait till we have some students in there. We will be doing a ribbon cutting and a ceremony, so I want to make sure I will plan that with Mr. Hathaway. That works with your schedules, so you all can be there. You can see the upstairs as well, our sonography lab, and we'll do some show and tell, and so you can kind of see what we've got going in action.
All right,
Thank
well,
you for that.
coming out
Thank you.
This morning. Next item is the court salary discussion. Ms. Wiggins and Ms. Mills.
Good morning.
Good morning.
I'm Kelly Wiggins, and
Rachel Mills.
and we are here to ask for salary supplements. And the reason why we are asking is because our state salaries are very low. The JDR Court and General District Court salaries are basically, we get raises whenever the state gives out raises. We don't receive merit raises. We don't receive raises for years of service and things of that nature. I have a handout for our salary classification. Anytime we do get a state raise, it's applied to every salary band. In other words, every time the salary goes up, it goes up for everybody. Of course, I can't find it now. Last page.
Kind of walk this up.
I think we also have some case statistics to provide you with too, from 2023 and for 2000 and for right now, January of this year. If we could provide those to you too. I have mine and Rachel has hers that show how quickly our case count is going up. Even though mine went down a little bit for last year, right now I've gone up 13% already for January, which is unusual because one would think that January would be a slow month. So we're going to hand these out to you too, if you don't
I think
mind.
General District last year, I think we did 12,000 cases, and then so far in January this year, we've done, I think, 917, I think it said.
Ms. Swing and Rachel, could you explain to the newbies here what you guys actually do?
Okay, I'm the juvenile court clerk.
Okay.
So our court handles all matters that involve anything regarding juveniles, which could mean cases that involve delinquency, traffic tickets, or any kind of delinquent matter like petty larceny, felony matters, misdemeanor matters, or abuse neglect cases involving children, custody visitation cases, and anything domestic related involving adults. In other words, like fights between married adults, protective orders involving family members, child support matters, things of that nature. We also have partnered with Cumberland Hospital to handle certain medical treatments involving minors as well. And that's kind of like a very general explanation of what we do.
And for us, General District, we do a lot of traffic tickets, criminals, and misdemeanors, felonies. We do civil cases, unlawful detainers, evictions, warrant and debts. So anytime a credit card company or anybody else is trying to collect money, they come through us. We partner with Department of Taxation, so we do, like, if your fines and costs are overdue or not paid, we withhold your taxes. I think we are about to work with a law firm with garnishing, so that way we can garnish people that are out of state as long as in-state, because right now we can only do in-state. And then the school zone tickets, that's a new thing that's just started. We had our first contested one that called this morning, setting that one up, which that is, our call volume has gone up drastically since those have started. We do protective orders. We pretty much, that's just the, I guess, small
Very
gist
general,
of it. Yeah.
There's a lot of paperwork involved, a lot of time involved. We have long court days. We don't have enough judge time to handle court days. We need more court days, but we share our judges with other courts. I share my judge with 3 other jurisdictions.
Yeah, same here. Judge Revere sits in Middlesex, Matthews, Gloucester, New Kent, and then Judge DeFord comes down and sits with us from Williamsburg twice a month. And then Judge Rennie, who's a retired judge out of Williamsburg, he comes and sits with us once a month. So, I mean, our court days have drastically gone up. When I started in 2010, we had court every Tuesday. Now we have it, the first week it's Tuesday, Wednesday, Friday. Second week it's Tuesday, Wednesday, Thursday. Third and fourth week it's Tuesday, Wednesday. So our numbers have drastically gone up. The state, I mean, same pay since I've pretty much been here since 2010. One thing I did want to hit on is so I guess they put in, so it's Virginia Code section 16.1, 69.45, just saying that localities can supplement the courts. There's currently over 20 localities that are doing it. I believe for population numbers, there's 10 that are, I guess, close to our population that are supplementing. The closest one in proximity to us is probably Hopewell City. They have 23,000 population, and they supplement their clerks 3,700 every year. And then I spoke to, some counties do it yearly. Some of them do it quarterly. I spoke to Washington County, their clerk's office. She told me they get, I think it was $675 quarterly. So there's different ways to do it. And then I guess the courts, we are state, sorry, I get nervous when I talk. Yeah. We are state employees, but we do a lot for the county. I want to say
we're hired solely to represent the citizens of New Kent County. Our job is only to represent the citizens of New Kent County. We do nothing else but represent the citizens of New Kent County. So that is our job. When we're appointed, we are appointed for the citizens of New Kent County. And another note, too, it's very hard to retain our attorneys with this kind of low pay. I know that I had a new position granted to me in December of 2022, and I'm already on my second person for that job because of the low pay. My first employee left to go to a circuit court for a substantially higher paying job.
So, as you said, that was salaries issue. The state's not considering trying to do some type of adjustment?
I know they go every year and they ask, and nothing changes.
I have a question. So, is population have anything to do with your salary? Like, as a clerk for New Kent, does the clerk of a higher populated county get more?
The head clerk.
So, as we're growing, does it increase at all?
So it's like a fight. When I got my full-time position, I had to argue with them, and I've argued with them for the past couple of years. They wanted to give me a part-time position, a full-time part-time position, which would do me no good. I needed a full-time position. So it was a back and forth and a back and forth. And they know we're the fastest growing county. One of the higher ups in the Office of the Executive Secretary's office lives in New Kent County. So he's fully aware of what's going on in New Kent County. But they don't do studies enough to keep the numbers up. We'll say that. It's very expensive for them to do these studies. And they're only done for certain things like to assign judgeships, which I think they're doing one now because certain localities are very in need of judges. But that's pretty much the legislators are the ones that drive these studies, we'll say that.
So the population would give you more positions, but it wouldn't increase your pay.
That's the last thing they're interested in.
Okay.
And our branch is one of the lowest paid branches because nobody really asks for us.
I guess the entry-level salary is the same across the state except for Northern Virginia.
Is there a contact that we could contact at the
Sure.
state level?
I can find you one.
Sure.
That's what I was going to ask is when was the last time y'all pitched this to the state delegation, the people that can actually affect your pay annually?
So we don't have a lobbyist or anything like that, and I don't know when they do. We don't know. We're kind of like in the dark. We have no idea what the Office of the Executive Secretary asks for us.
Would it be unusual for a locality like y'all to go to your legislators and ask for an increase? Or tell them that you're interested in an increase?
Well, I don't think it's encouraged in that sort of, we have a code of ethics where we can't get involved. Like we could not present this to like the House of Delegates. That's something that we could not do without the Office of the Executive Secretary knowing about and approving.
I will add, though, in the last 2 years, this has been an item on our legislative agenda that we've adopted and have shared with our state representatives.
And I think our current senator put in a budget amendment in 2021 that was killed because it had a $9 million fiscal impact. So that's something I'm certainly happy to talk with our state delegation about. I think that's probably everybody sitting here is because it is a problem. And question for Mr. Hathaway, are there any state-funded positions within the county that we subsidize in the way that this proposal is put forth?
No. There are some constitutional officer positions that, and I really don't call it a subsidy, they've taken on additional responsibilities above what they're constitutionally mandated to do, so therefore they do receive additional pay from the county. But, health department, VDOT, other state positions, we do not supplement.
All right, does any other board member have any other questions?
I'll say not so much a question, but a comment, Mr. Chair. Firstly, thank you guys for what you do. I think it is a very, very important role that you serve. I could not imagine in my prior life I probably called Miss Mills 50 times asking for continuances and things like that. So I know that you guys do a lot of work, but I do think it's important to note that our courts don't just serve New Kent County citizens. They serve any instance that happens in New Kent. So we have a broader job, and maybe this is a broader question and some that I think we need a bit more detail at this time. Because the way, when I was reading the preparation materials, the way I read that was localities bordering us get this extra amount. But really only Henrico gets the extra amount, and their population is dramatically different than ours. So I think it's something that maybe we could talk about continuously, and I talked with Mr. Chair about this before that we've talked about this presentation, you know, in preparation for today and then in previous years. I think it's worth the conversation, but I do think some more work maybe with the Office of the Executive Secretary and our state delegation is in order.
I do know it's gone up over the years, because I know when we first started and I asked for this, it was maybe like 12 localities, so it's gone up to 20. But, I mean, we'd appreciate any help we can get.
Yes. And I know courts in our district, I know Williamsburg, King William, King and Queen courts are asking for it. So you never know who will get one.
We'll look it up, we'll talk it out and doing our budget process and try to get just some, what Ms. Stewart said, trying to look into some other ways to help. I know when session started, and somebody else might know this, they were looking to add another judge to us. Did that get killed, or is that the circuit court? Oh, that's circuit court. Okay.
Hopefully, fingers crossed, they'll look into general district soon.
All right. Well, thank you all for
Thank
being
you.
here. Next item is other business. Any board members have any other business? Mr. Moyer?
Yeah, yesterday I had the experience to be one of the taste testers down at NASA for the Langley Research Center. There was our Bridging Communities culinary class was one of 6 high schools that was able to present to, I think there were 12 of us taste testers, a couple of city councilmen from Hampton, a couple people in the restaurant industry, and a couple people from NASA. And it was quite interesting. They had to make a dish for a breakfast meal that fit guidelines that NASA gave them. And to that point, they made some interesting concoctions. They were very tasty. They could have all used a little salt. Because that is one of the things that they want to curb in space. And the other thing I found out, and I mentioned to some people before, is that the one thing astronauts like is they like spicier foods. And I didn't quite understand it. And then one of the students explained to us in their research, they found that because in space, when particles dissipate, most of your taste is from smell. So the particles become, as I said, dissipated, and you don't get as much of a smell. Thus, you don't get as much of a spice. So they like having spicy food. So to give it some kind of taste, because they can't have the sodium. But there were, like I said, 6 high schools. This is one of a number of different places where this event goes on. And there were 45 total high schools, and 10 of the high schools that are the highest ranked will go to Houston and prepare their food there. And then the winner, their breakfast item will go to the International Space Station. So what we got to taste was what would be eventually freeze-dried and then water added and microwaved in space. So I was happy that we got to taste it the way it was versus the way it will be. But we can be very proud of our bridging communities. The instructor, mentor, and the students did a really good job, gave a great presentation, and along with the other schools too, though. But it was interesting to hear their ideas for their future, whether it was to stay in culinary or to look for, NASA be a place to work in the future. So I appreciate that ability to go to that, and that's it.
Mr. Moyer, what did you eat?
Okay, well, we had cosmic congee with chicken and ginger. That was ours. That was Bridging Communities. And then one that was pretty good was cauliflower-crusted crab quiche, which that one, the sodium hit right at the top level, that they could have. But so those were some of them. It was interesting.
They serve you mimosas with.
Anybody have anything else?
I'll see, Mr. Chair, I have my next District 5 office hours on March 5th at 5:30 at Station 3. It'll be 5:30 to 7:30, and the school board chair, Greg Reimer, and I will be there together.
Okay. Mr. Steers might kick me out, but I'm going to ask for a meeting change in April.
Graduating or something?
Yeah, actually, it's like a son to me that's graduating from the Air Force boot camp out in, so if it's not, I understand, but April 8th is, I'm going to ask that meeting to be changed. If y'all don't want to change it, I'll just you can run it.
We can't do without you.
So, I know, I'm sorry, but I really don't. April 4th? How about April 4th?
Mr. Chairman, that may coincide with a Chesapeake Bay Board meeting. Don't know, we don't have them every month, but that's when it's scheduled to occur.
Can we move that?
We could.
Okay. Did everybody else want? Okay. Thank you all. It's probably. Need a motion on that?
Mr. Chair, I'll make a motion to move the April 8th Board of Supervisors meeting, the regularly scheduled one, to April 4th instead.
Thank you, Ms. Pearson. Any discussion? Ms. Watkins, will you poll the members?
Mr. Moyer?
Aye.
Ms. Pearson?
Aye.
Mr. Steers?
Aye.
Ms. Stewart?
Aye.
And Mr. Evelyn?
Aye. Thank you. I think Mr. Moyer has a motion.
I have a motion. I move to go into closed session pursuant to Virginia Code Section 2.2-3711A1 for discussion and consideration of prospective candidates for employment, specifically for the General Services Director position.
Thank you, Mr. Moyer. Ms. Watkins, will you poll the members?
Ms. Pearson?
Aye.
Mr. Steers?
Aye.
Ms. Stewart?
Aye.
Mr. Moyer?
Aye.
And Mr. Evelyn?
Aye. There won't be any business afterwards, and we will be adjourning. There will be adjournment afterwards.